Eating Disorders by Claire and Maya.
Signs of eating disorders. Symptoms of eating disorders can include dramatic weight loss, dressing in layers to hide weight loss or stay warm, preoccupation with weight, food, and calories, refusing to eat certain foods, pushing away specific food groups such as carbohydrates, proteins, etc., frequently making comments on being fat or overweight despite recent weight loss, denying your hunger, or complaining of abdominal pain, constipation, cold intolerance, and lethargy.
Anorexia is an eating disorder that causes people to obsess about weight and what they consume. In order to keep up with skinny expectations, people starve themselves and have tunnel vision for flaws. Anorexia is chronic, meaning it will last years or people's entire life. Some cases are so extreme, death is imminent and patients must be hospitalized. Patients of anorexia commonly feel burdening and guilty and deal with extreme mood swings from malnutrition.
Bulimia nervosa, better known as bulimia, is an eating disorder much like anorexia that is commonly known for people binge eating large amounts of food and then getting rid of the food any way possible. Bulimic patients, to get rid of food and calories, commonly do so by vomiting, which is self-induced, misuse laxatives, take weight loss supplements, and overexert themselves through strenuous exercises so that they are thin and perfect. Though bulimic patients strive for perfection, they see the smallest flaws and judge themselves harshly. Bulimia is not related to food and weight, but heavily based on self-image and others' perceived image of them. Most assume bulimia to be a physical disorder, but bulimia is a psychological and emotional disorder. Bulimia is caused because of the obsessive desire to lose weight and the guilt and shame of eating food.
If you think you may have an eating disorder, it is important to get help right away. If you cannot tell whether you have an eating disorder or not, scheduling an appointment with a doctor or just talking to your parents may help you decide. National Eating Disorders and Awareness Organization says getting a diagnosis is the first step towards recovery from an eating disorder. Treating an eating disorder generally involves a combination of psychological and nutritional counseling. While eating disorder treatment may be grueling and saddening, eating disorders can be fatal if left untreated, and getting professional help is important. When in treatment, patients may live at the facility in extreme cases, but most patients continue a normal life. Typically, patients meet about twice a week with therapists or support groups to talk about eating disorder-related problems. Thanks for listening to our PSA.